Hello, my name is Dr. Behnam. I'm a board-certified dermatologist practicing in the beautiful Santa Monica, California. I'm a laser and skin cancer specialist, and today we are going to talk about the difference between Dysport and Botox. Both Dysport and Botox are indicated for frown lines and lines on the face. Botox was approved, the cosmetic Botox was approved in the United States in 2002. Dysport was approved in April of 2009. The difference between the two really goes down to their molecular structure. The botulinum toxin in Botox is known as ONA botulinum toxin. It's actually different than the botulinum toxin in Dysport, which is ABO botulinum toxin. Clinically, as you could tell, the Botox bottle has 100 units per vial, whereas the Dysport actually has 300 units per vial. The difference, as you could tell, is that in this bottle, there's only 100 and there's 3 times as much units in the Dysport bottle as in the Botox bottle. Clinically, we basically inject Botox and Dysport the same way, which means that, for example, when somebody got about 10 units of Botox in their frown line, when we want to convert that to Dysport, I multiply that by 3. So we inject about 30 units of Dysport in this area. We do this 3 times multiplication because in our clinical experience, we have noticed that in order to achieve the same result between Botox and Dysport, you need this conversion of 3 to 1. I have a lot of my patients that have had Botox in the past, and they come basically and they try out Dysport. I always ask my patients, what is the difference? Did you see any difference? Which one worked faster? Which one lasted longer? Which one basically had more of the side effects? My patients tell me, about half of them tell me, that the Dysport does kick in a little bit faster. It kicks in about a few days faster than Botox. And about half of my patients tell me that Dysport does last a few weeks longer than Botox. However, everybody is different. Not everybody is going to respond to Dysport the same way. So I always tell my patients, give it a try. You might like Dysport a little bit better than Botox, or you might like Botox better than Dysport. In our clinic, we always have both Botox and Dysport basically in our clinic, available, ready to go. We give the patients whatever they like. We basically decide this upon which one is going to work better for you. Everybody is different. Some patients Botox might work better, some patients Dysport might work better. With respect to side effects, I think they're pretty much about the same. The most common side effects of both Botox and Dysport includes bruising, headaches, some pain, and injection sites. And I think they're pretty much equivalent. With respect to longer lasting, we have talked about that. With respect to efficacy, as long as you dilute it proportionally, I think you're going to see good results. There are some people that actually only do a 2 to 1 dilution, which means for every 1 unit of Botox, they put 2 units of Dysport. I don't think that that is going to work. That will not give you the same effects. In my experience 3 to 1. 3 units of Dysport for every 1 unit of Botox gives you pretty much equivalent results. Finally, I've had a lot of my patients tell me that when we inject Dysport, it looks a little bit more natural. And I typically ask my patients, well, what do you mean by that? Why is it more natural? They say that some patients don't get that frozen look that sometimes they would have gotten with the Botox. I think this really depends on how much Dysport and Botox are going to inject. Certainly you could inject a little amount of Botox on the forehead and not to give you that frozen look. But then at the same token, you could inject a lot of Botox on the forehead and give you a really frozen look. So I think that's a little bit subjective, and it really depends person to person. Again, this is Dr. Behnam. I'm a board-certified dermatologist, and I love both Botox and Dysport. It really depends on the patient to see their body is going to respond better to which one. So I tell my patients, look, give a try to both of them and see which one you're going to like. If you have any questions, feel free to give us a call, 310-315-4989, or visit our website, santamonicaskin.com, for more educational videos like this about Botox and Dysport. Have a beautiful day.